Communication Competency by Janelle Blake, Emily Jones, and Ann Navarro. The first topic that we will be covering is SBAR, communication using the SBAR technique. What is communicating using the SBAR technique? Well, SBAR is an acronym for Situation, Background, Assessment, and Recommendation. Several protocols have been proposed for improving communication between nurses and physicians. SBAR protocol is a technique that provides a structure for communicating among healthcare clinicians by organizing the delivery of relevant patient information using those subheadings. SBAR was designed primarily to promote patient safety during urgent patient care situations by structuring healthcare information in a logical sequence, but the technique also benefits clinicians in that it makes communication more readily understood and more efficient. Therefore, it is also utilized when communicating patient needs to the treating clinician by telephone and for communicating during patient handoff to other clinicians or departments. SBAR was created by the U.S. Navy personnel as a method for conveying critical information in an effective, timely, and succinct way. SBAR tool enabled all users, regardless of the level of command, to communicate via a common structure. The SBAR tool was introduced to the healthcare in 2002 to guide communication of patient care information. Evidence of integrated literature review indicated that SBAR was an effective intervention for patient safety through improved communication. And it has been shown that the root cause of errors often could be traced to faulty systemic processes. Errors in communication have been a major source of miscalculation and misdirection in the healthcare systems. SBAR creates a common language for communication of key patient care information. SBAR also results in more concise reports and plans of patient care due to the anticipated nature of it. Communication errors have led to an estimated 98,000 deaths and $17 billion in healthcare costs annually. SBAR is divided in 5 subheadings. The situation portion of SBAR. The person will identify themselves and the patient's age, code status, chief complaint, or diagnosis. The situation should be stated succinctly in approximately less than 10 seconds. Under the background information, it contains patient's history of present illness, pertinent medical history, allergies and medications the patient is taking and was given. Under assessment, it includes pertinent physical exam findings, vital signs, assessment of your skin, neuro, cardiovascular, respiratory, gastrointestinal problems, pain assessment, significant diagnoses completed, and treatments given. Under the recommendation phase, it is included what the person giving the report would recommend going forward, such as treatment plan, medication changes, IVs, or further diagnostic tests needed. Then the last portion of SBAR is documenting. Documenting your communication with other clinicians at the time it occurs is important because discussion about patients or interventions can quickly be forgotten in a busy clinical environment. It is essential to clearly document, read back, and sign verbal orders. Inadequate documentation can place a nurse, clinician, and healthcare facility at risk for legal liability. So, SBAR promotes, in summary, for the SBAR, it promotes critical thinking skills, enabling staff to do more than collect and convey data. It can improve situation awareness, reduces issues related to organizational hierarchy and experience, and improves collaboration between nurses and physicians. There are 4 types of shift reports that are typically utilized. We have the verbal reports, the tape recordings, phone calls, and written reports. Shift reports occur at least twice a day for every patient, but the process rarely is taught in basic nursing education. Therefore, it is important to keep that in mind and make sure that you're following all of these prompts and documenting all your findings and everything that you communicate with the other healthcare team members.
The second topic we're talking about is whiteboards as a communication tool. Patient whiteboards can serve as a communication tool between hospital providers and as a mechanism to engage patients in their care. Wide range of information can be relayed, such as day and date of care, patient's initials or their preferred name to be called, name of healthcare providers, patient goals for the day, which should ultimately guide determination of their goal for the day, as this engages them directly with a plan. Achieving patient-centered initiative. Bedside nurses should directly engage patients each morning to help place a goal for the day on their whiteboard. Tolerable pain. Time when last pain medication was administered, name of the medication, doctor's numbers and other hospital extensions, physical, occupational, or respiratory therapist appointments, patient or family concerns and questions for providers, which create an opportunity for clarification or treatment and discharge plans, family contact information. A study shows that 80% of nurses, house staff, and attendings agrees that the bedside nurse was the single most important provider name listed on a whiteboard. Majority also believe that nurses should be responsible for any information written on the whiteboard, and nurses and physicians together should create goals for the day. Whiteboard use can only achieve its full potential if it is appropriately and completely filled and the information written down is relevant to the patient. Although nurses is the main facilitator in writing and updating the whiteboard, it is beneficial to all healthcare providers to utilize it as a shared communication tool. Bedside handoff shift report. What is a handoff? A handoff is a transfer and acceptance of patient care responsibility achieved through effective communication. It is a real-time process of passing patient-specific information from one caregiver to another, or from one team of caregivers to another for the purpose of ensuring the continuity and safety of the patient's care. Some factors involved in handoff reports include healthcare provider training and expectation, language barriers, cultural or ethnic considerations, and complete or non-existent documentation. According to a study, communication failures in the U.S. hospital and medical practices were at least responsible for 30% of all malpractice claims, resulting in 1,774 deaths and $1.7 billion in malpractice costs over the 5 years. Dr. Mickey said, when a patient is handed off to another healthcare provider for continuing care, treatment of service, the type of information the receiving provider needs may not be the information the sender provides. Critical content to communicate to the receiver during handoff should include sender contact information, illness assessment including severity, patient summary including events leading up to the illness or admission, hospital course, ongoing assessment and plan of care, to-do action list, contingency plans, allergy list, code status, medication list, dated laboratory tests, and vital signs. These are the 8 tips for high-quality handoffs according to the Joint Commission.
The next topic we'll be talking about is purposeful hourly rounding. Hourly rounding has been suggested as a primary mechanism to address basic patient needs as well as enhance patient safety and experience. Published reports have suggested that systematic and purposeful rounding by nurses results in improved patient satisfaction. Evidence-based nursing practices collected by hospitals have documented some of the improved outcomes. 52% reduced in patient falls, 37% reduction in patient use of call bells and lights, 14% decline in skin breakdowns and pressure ulcers, 12% increase in patient satisfaction ratings. Nursing responsiveness is an important factor in a patient's experience of care during hospitalization. Proactive and regular checks help patients to decrease their anxiety. Patients are concerned if nurses are able to attend to their immediate needs in a timely manner. Proactive nurse rounding has been associated with decreased call light use. How is hourly rounding performed? You want to check on patient hourly. You want to enter the room and identify themselves and tell patient they were present to do their rounds. Schedule tasks performed. Assess the 4 P's, which are pain, potty, position, and possessions. Before leaving a room, staff asked the patient if anything else was needed, emphasizing they had the time to address any needs. Once tasks were completed, the patient was informed a healthcare staff member would return within an hour to round again. So the 4 P's of hourly rounding. The 4 P's generally addressed during an hourly round include pain, potty, position, and possessions. These are the foundational elements to ensure patient safety. Rounding involves a series of activities that are designed to promote patient safety, improve patient outcomes, improve patient satisfaction, and enhance care delivery. During a round, a patient's pain, elimination needs, and position are addressed. Pain and elimination needs are assessed as they may be potential indicators of a change in the patient's medical condition. Assisting patients with positional changes during a round helps to maintain skin integrity and support circulation. Making sure that the patient belongings are within reach and assisting patients with their elimination needs are activities associated with fall prevention. One way in which rounding enhances care delivery is through the reduction in patient call-out use. Utilizing these main components during nursing hourly rounds can help reduce the patient's anxiety. Clinical implications on hourly rounding include the following. Call-out use. With call-outs ringing less, the nurse spends more time on patient care instead of going from room to room dealing with issues as they arise. During nursing rounds, the nurse gets a good grasp on the patient needs and uses the opportunity to plan with the patient. The patient knows nursing staff members will return as promised and uses the call light less frequently. Patient falls. Hospitals that incorporate hourly rounding note positive improvements in patient safety. Patient falls occur less frequently. When staff members round on patients every hour and address basic needs such as toileting and placement of personal item, risks for falls decrease. Patients are less likely to get out of bed when personal needs are met. Pressure ulcers. Turning and repositioning are considered basic nursing care. When nursing staff members maintain regular turning and positioning schedules with their patients, pressure ulcer rates on inpatient cases can decrease by up to 56%. In patients with existing wounds, regular turn schedules contribute to the healing process. Patient satisfaction. Studies have shown that hourly rounding, increased nursing presence leads to better quality of care, which in turn has a positive effect on patient satisfaction scores. Using specific scripts and electing key information from the patient about personal needs allows the nurse and patient to develop a plan of care that is optimal for both players. Studies have shown that satisfaction was 92% to 98%. For nursing satisfaction, nursing care is more efficient and less stressful when hourly rounding is performed. Hourly rounding frees more nursing time and decreases frustration by optimizing shift time utilization. Overall, hourly rounding can be defined as a systematic, proactive nursing intervention designed to anticipate and address the needs of hospitalized patients. Because studies have shown that hourly rounding, done correctly, can promote quick quality, safety, and satisfaction, it is considered to be an evidence-based nursing practice.
The last 4 slides of this PowerPoint contain our references from which we obtained our information.